Hello, my name is Casey, and today I will be presenting a policy analysis on the overmedication of United States military veterans, focusing on the No Pain for Veterans Act. Overmedication is a significant issue for veterans receiving care through the VA, or the Veterans Administration. Many veterans are prescribed multiple medications simultaneously, particularly opioids and psychotropic drugs. This practice heightens the risk of dependence, overdose, and long-term health complications. A primary reason for this problem is the limited access to integrative, non-pharmacological treatment options such as physical therapy, acupuncture, and cognitive behavioral therapy. Veterans often suffer from chronic pain, PTSD, depression, and traumatic brain injuries. In the past, the VA primarily relied on medication-heavy treatments, which led to significant issues with polypharmacy. Currently, over one-third of VA patients take 5 or more medications simultaneously. This trend has been associated with higher risks of mortality, hospitalization, overdose incidents, and suicide among veterans. The issue of veteran overmedication is influenced by several factors. Socially, veterans may face isolation, stigma, and challenges during reintegration into the civilian world, which can exacerbate their symptoms. Economically, medications are often cheaper and easier to obtain than long-term integrative therapies, leading to them being the default treatment option in many situations. Politically and legally, while policymakers acknowledge the problem, the regulatory process of the Veterans Affairs system tends to move slowly. Ethically, overmedication poses risks to autonomy, justice, and non-maleficence, as veterans may not be fully informed about or able to access safer alternatives. There are currently 3 federal bills aimed at addressing the issue of overmedication. H.R. 136 focuses on reviewing suicide rates and prescribing practices among veterans. The second bill is H.R. 2623, which establishes centers dedicated to researching innovative therapies, and that includes psychedelic-assisted treatments. The No Pain for Veterans Act mandates that VA providers offer integrative, non-opioid treatments before prescribing opioids. Each of these policies has its own benefits, but they vary in terms of scope and feasibility. The most effective policy option is the No Pain for Veterans Act. This bill aims to expand access to therapy such as physical therapy, acupuncture, and cognitive behavioral therapy before opioids are even prescribed. By reducing initial opioid exposure, it is both cost-effective and aligns with national strategies for opioid reduction. Furthermore, because it has bipartisan support and does not restrict provider autonomy, it has a stronger chance of being passed and successfully implemented. Several stakeholders play an essential role in advancing this policy. That includes the VA, congressional committees, veteran service organizations, nurse practitioners, mental health professionals, and veterans and their families. Each of these bring different insight and are critical for the success of policy adoption. To support this policy, several advocacy strategies can be employed. For lawmakers, evidence-based policy briefs and cost analyses are particularly effective. For clinicians, continuing education programs and workshops can aid in the transition of integrative care. Collaborating with veteran service organizations can enhance campaigns that focus on veteran-centered storytelling. Utilizing social media, infographics, podcasts, and community forums can also help raise awareness. Importantly, these advocacy materials should be tailored to their literacy levels, cultural backgrounds, and age of veterans. Overmedication among veterans is a major public health issue with serious consequences. I believe that the No Pain for Veterans Act provides a practical and ethical solution by expanding access to integrative non-pharmacological treatment options. As nurse practitioners, we have the opportunity to advocate for these changes and promote safer, more holistic care for our nation's veterans. Thank you so much.